Hi, my name is Dr. Rhonda Karg. Welcome to my podcast, Help Me Rhonda. And today I'm going to be talking to you about empathy, compassion, and burnout. So for many, many years, we believed that empathy was really the foundation of what it was to be a good person. And as a result of that, empathy was being touted as something that the world needs more of, is empathy. And then recently there was someone by the name of Paul Bloom. He wrote this book called Against Empathy, and he's a researcher at Yale. And what he talks about in this book is the fact that empathy actually leads to burnout. And the reason for that is that in the case of empathy, if a person is suffering and you're being empathic, what does that mean? It means that you in turn are suffering. And for people that are working in a helping profession, such as psychologists or other mental health professionals, compassion is really what we need, because in the case of compassion, the boundary between where we end and that person begins is very clear. In the case of empathy, the boundary between where we end and that person begins is what we call blended. It's not clear. And as a result of that, an empathic person can act like a sponge that takes on the suffering of the other person. And if you think about helping professions, if they're taking on the suffering of the people that they're serving, they in turn are going to suffer and in turn are going to get burned out. And one of the things that the author talks about in this book is the fact that when you approach a situation with the spirit of, I'm here to help, that's when the boundary is clear between where you end and they begin. That's compassion. I'm here to help. I'm not here to fix. I'm here to help. Versus empathy, the idea is I'm here to fix. I'm not here to help, I'm here to fix. And the reason I'm here to fix is that I'm suffering as a result of your suffering. And that leads to burnout because you're taking on so much responsibility for other people. And there's so many situations in life where we don't have the power or the control to fix things for other people. We really only have control over what we focus our minds on and our behavior. And so a lot of times we don't have the ability to really truly fix things for other people. But when we take on that responsibility and believe that we should be there to fix things for people is when it leads to stress and when it leads to burnout. So I would like those of you who maybe are vulnerable to being empathic, vulnerable to being overwhelmed when people want help from you, you can ask yourself, am I approaching this person or the situation from a place of wanting to help or from a place of wanting to fix? And if I'm coming from a place of wanting to fix, is it because I'm suffering? Is it because the boundary between where I end and they begin is not clear? And if so, what effect is that having on me? Because that's a lot of pressure to fix things for people. When you approach a person from a place of compassion and the boundary between where you end and they begin is clear, and you're there to help, that actually makes the person you're helping trust you more. because you're calm, confident, and centered. You're not suffering because that boundary between where you end and they begin is clear. Okay, you're there to help. So you're calm, confident, and centered. And they did this one study that they describe in the book, Against Empathy, where they would go into hospital rooms with people that were going to have surgery the next day. And there would be two conditions. In one condition, the doctors would come in from a place of empathy. So if the patient was anxious about surgery the next day, and the doctor's practicing from a place of empathy, if that patient is anxious, what's going to happen to that provider? They're going to get anxious, right? Because they're like a sponge. And if you're in the hospital and you're having surgery the next day, do you want your doctor to come in from a place of empathy and therefore anxious as well? Or do you want the doctor to be practicing from a place of compassion, meaning that they're there to help and they're calm and confident and centered, but they're not anxious because the boundary between where they end and you begin is clear. You want that doctor. You want the doctor that's calm, confident, and centered. So for those of you that are in the helping profession, if you can also bear in mind that you're going to be a much more effective helper if you're practicing good boundaries. And a lot of people in helping professions are naturally empathic people. I'm an empathic person, but when it comes to helping people, it is very important for me to maintain clear boundaries between where I end and the person I'm helping begins. Because if I'm burned out and I'm stressed out, I'm not going to be effective with that person, or I'm not going to be effective with the other people that I work with, because I'm going to be operating from this place of adrenaline and activation, and I'm not going to be able to be as present with people. Because remember what I've said to you before, if you have too much adrenaline running through your veins, right? If in the case of feeling like you need to fix things for someone, you're going to have adrenaline running through your veins. You're not going to be able to access your upstairs brain and think about what might be most effective in that situation. So you're not going to be as good of a helper if you're practicing from a place of empathy. You're much better off to practice from a place of compassion. And to be honest with you, at the end of the day, I might see 9 or 10 patients, and I'm here making a YouTube video because I practice good boundaries with the people that I work with. And as a result of that, I don't leave work feeling depleted. I leave work feeling energized. Okay, and that's the difference. That's the difference between acting from a place of empathy versus compassion, is that boundary. And being able to help from a place of compassion. I'm here to help. I'm not here to fix. You'll be much more effective. You'll enjoy your work more. And you'll just generally be less stressed out, more effective. Okay? So this is a great book. If you're interested in reading more, Against Empathy by Paul Bloom. Great book. I highly recommend it, especially for people that work in the helping profession. Thanks for joining me today, and have a good day.